Hi there. This is Dr. Tatyana Borisiak, and I have a special guest in my little studio. Her name is Beth Panoff. She's an owner of Acadia Institute and Wellness. She is a family nurse practitioner, and she shares the same passion as I do for functional medicine. And she's going to share with us some of her thoughts on very actual problem that is occurring around these times is sleep. So Beth, could you please tell us a little bit about yourself and why you're here?
Yes, thank you, Tatiana. It's so good to be here. So I'm the owner of Arcadia Institute, which is currently a functional medicine practice, doing right now all telemedicine, serving all of North Carolina. I've been a nurse practitioner since 2003, and I'm extremely passionate about functional medicine, helping people to just live healthier lives and just reach their optimal health. And one of the things that has really become so evident to me is the problems around sleep. It's such a pervasive problem, and there's just thousands of people, really having sleep issues. And a large part of that is women, especially after menopause, as you know. And so that's a large part of the population that I see is working with a lot of hormone imbalances, and especially women around the perimenopause, menopausal time. And because of the issues with hormones, sleep becomes a really big problem. Two of the main things that I see that cause sleep issues really is hormone imbalance and then stress, as you know.
When you say hormone imbalance, what exactly you imply? I mean, you mentioned something about menopause. Would it apply only to women or men? And we can summarize and put in this category both.
We can actually, because it applies to men as well. And so there's lots of hormones that become imbalanced due to stress and just aging process. So there's also, men suffer from loss of testosterone, cortisol levels rise, which also affects their sleep, and thyroid also dysfunction. And so men also suffer from this as well, and it affects their sleep. I see a larger portion of women really suffering from that because of the loss of estrogen specifically, and progesterone. Of course, progesterone balances out the estrogen. So between the estrogen and progesterone and thyroid dysfunction, I see a lot of women really suffering from this, a little more so than men, but certainly both. Anyone can have hormone imbalances, and it can disrupt sleep, circadian rhythm, and sleep cycles.
Okay. Yes. And how do you think you can look into it? How can you address this kind of issue? Because we all know many times patients come to our office and they're looking for Ambien, they're looking for some kind of magic pill to help them sleep. And that may not be necessarily the right answer.
Exactly. Yeah, exactly. There is no one quick or fix or pill for it all. All right. So my approach is always lifestyle first, focusing on exercise, focusing on nutrition, and then looking at the hormone levels and seeing, if we can replace them, bioidentical hormones, and bring them back into balance. But even with that, the lifestyle piece has to be there. And then another thing, one other thing that I see so commonly is the stress component with that. And so I tell most of my patients, I talk to them about doing some kind of like meditative practice or breathing exercises to also help with the sleep issues, in conjunction with replacing the hormones and proper nutrition, and of course targeted supplementation for help with that. It's really all about not only replacing the hormones, but also working on that circadian rhythm. And there's other things we can do to help that, such as
how would you outline maybe some specific example or some specific patient that you would present, and how would you treat that patient?
Well, I would look closely at what's causing, if there's specific sleep issues, first of all, do they have sleep apnea? Of course, we need to get tested there and make sure that's not an issue, because that can be corrected. And then look at their stress. And, if there's stress going on in their life that, we can't always change what's going on outside of us, but we can work on how we handle it. And so I try to really focus with them on what is their sleep routine. Are they doing some breathing exercises, especially at night before bed, working on sort of setting the stage for sleep in the evening? right? So turning off devices, lowering the lights, doing soothing, relaxing exercises in the evening time, making sure they're eating dinner earlier, not eating late before bed, because that can also disrupt the circadian rhythm, cause sleep issues, and then replacing those hormones. So, balancing the estrogen, progesterone, testosterone, thyroid hormone, and of course, looking at any adrenal dysfunction, which sometimes that can be also, the solution for that can be also just some supplements, some herbs, nutritional supplements.
I see. So if you were to name one biggest offensive factor to impair someone's sleep, what would you name?
Just one. Well,
just one, the biggest one.
I honestly, it's close with the hormone imbalance, but really one of the things that with the meditation piece that I work on is that sympathetic dominance. And so that's sort of that, a lot of people have heard of the fight or flight mode.
Right.
When people are stressed, and we live in a very stressful world right now, we're overworked, we're running, doing things like crazy, just being stressed, working out hard. If we don't give our bodies time to relax, then we're in that fight or flight mode. And that's when I speak to so many people, especially women, who say they lay down at night and they just can't sleep. Their mind just starts racing. I call it the monkey mind. It just goes crazy. And so that's when I know, they're sympathetic dominant, and they really need to work on that breath work, switching that nervous system back over to the parasympathetic dominant, where they can actually relax. And that's the term that we call rest and digest. So their body can get some rest. When it's time to eat their food, they can digest their food, their body can repair. And so it's that balance between those two sides. I think that's probably the biggest thing that I see. And then real close to that is going to be those hormones getting the balanced.
Yeah, that's definitely, I can see that happening, especially we're in this world where we're going to work, we're busy, we have a checklist. I'm a checklist maker. I go to bed and I check everything that I had from the morning. But of course, definitely I have to stop myself many times and make sure I don't work out at midnight, make sure I don't eat late meal. And hormones definitely will affect women especially, but men as well. I know it's almost equally as important, although the hot flushes would be the biggest part in the hormonal imbalances of the women going through the postmenopausal menopausal period. And what medications, if you were to prescribe some, would be effective, you feel, and in what order you think you could prescribe them, like starting from supplements, prescription medications?
Right. I don't really do the prescriptions anymore. For supplements, I like doing like melatonin, a combination. So like an herbal combination that includes some low dose melatonin, maybe some valerian root, L-theanine, some GABA. So some kind of combination like that will really help just to, bring the brain down a little bit.
And have you seen success with those?
I have. Yeah, I have.
It's definitely so. And I would agree with Beth, definitely, because that magic pill that sleeping pill, every time a patient comes to the hospital, especially, the first phone call when the patient gets in, even they have a million of other problems, the reason why they got admitted to the hospital, they ask, can I have a sleeping pill?
Right. And, you can't blame them, only because sleep is so crucial, right? I mean, it's frustrating when you can't sleep. And, and then, when you don't get a good night's sleep,
when your healing happens, when you sleep, your healing happens.
Yes,
that's when your body recharges, resets. So sleep is very important. And definitely, if you have sleeping issues, I think person has to be looked from all aspects of life, hormonal, stress level, underlying diseases, underlying factors. There's so many. Sleep apnea, patient gets up to the bathroom so many times at night. That also makes a difference. So it's something that you would have to do individualized approach. But there are ways to address it and treat it, definitely, natural ways, especially.
Yes. And there are other ways to handle it as well. I mean, there are also some peptides that are very helpful for sleep.
Which one would you particularly use?
Well, the one that I really like to use the most is the growth hormone releasing peptides and growth hormone releasing hormone combination, like CJC ipamorelin. I'm a big fan of for most people taking it before bed, because it helps with, helps get into that deep sleep state. In addition to, of course, helping the pulse of the growth hormone, which is, you want that more at night for repair and healing.
I've had some good results with that. People have a very, very good sleep and restful night with CJC ipamorelin, definitely.
Yeah, yep. And then there's a few others, like there's VIP and epitalon also, which work with the circadian rhythm balancing, kind of bringing that back into regulation. So
that'd be something that you would have to use every night or on occasion or a course or a cycle while you're working out, I guess, your lifestyle.
Right. It depends. For some people, they have to use it consistently, but some will just cycle it depending, like you said, on their lifestyle. If they're traveling a lot, so you're really disrupting that circadian rhythm, you're going to have to cycle that and utilize some of those peptides like the VIP and the epitalon to help get back into regulated state, after, say, you're traveling across the world or across the country. So it really depends, depending on the individual. And some people need it continuously. But, like you said, it's not one size fits all. And so, it's so individualized, which is, why this is such a different type of medicine. Right.
Definitely. I think it is, sleep is super, super, super important in our daily routine for pretty much everything. Because if we get restful nights of sleep, we function well at work, we can enjoy life, we can look good. Right. Our skin looks good, our body looks good, we can be effective and productive in all the other things that we do. So thank you, Beth, definitely. So if there's one takeoff point from today's little talk, sleep definitely is not something that we can discuss in such a short conversation. I would love to touch base with you and maybe go a little bit deeper on some of those peptides that you mentioned and kind of dissect it and get a little bit of insight and more feedback from the patients, or maybe on the next talk. But if there is one takeoff point from this conversation, what would you like to wish to your patients? What are your recommendations to your patients to get their sleep under control? What's the first starting point?
I think the first starting point really is getting a schedule. You have to have it helps to have a structured schedule and routine, because without that, you can, take your hormones and take your peptides and do the other things. But if you don't have that routine down and that set kind of time frame where you're winding down and get ready to go to sleep, it's still, you're going to be all over the place. So it's really helpful to have that routine. That sleep hygiene is so important, and just that routine. And then, look into something that also tracks your sleep, a wearable device. That's very helpful as well, like an Oura Ring or something like that.
I see. Okay, very good. Thank you so much. I think it's a good start. I think I probably would like to implement some of those on my schedule tonight, in my busy schedule. But yes, we do have to stay organized, and every day as our routine changes and we're very busy, we have to kind of set back and reset our clock and try to go back and do that structure, because that's what's really going to keep us in shape and healthy and stress-free and give us a good rest so we can be productive the next day.
Absolutely. And prevention of, age-related diseases, very important. That's a big part of it too. That's why I'm so passionate about getting a good night's sleep.
Thank you so much, Beth. And we'll see you next time. Thank you, everyone. Have a good day.
Thank you, Tatiana. Bye-bye.
Bye-bye.